If you're a health worker, you're probably finishing your shifts feeling exhausted, cynical, or emotionally flat, wondering if you just lack the resilience to handle the job anymore. But here's the reality. I'm not going to give you another mindfulness app or tell you to build more personal resilience, because burnout is not a personal failure. It's not a lack of coping skills. It's your body doing exactly what bodies do inside systems that are no longer coherent. Something intelligent in you has been adapting, and it makes complete sense. Burnout is often framed as a personal failure, a lack of resilience, a sign that you're not coping well enough. But burnout is not weakness. Burnout is what care looks like when safety has been missing for too long. When you're forced to work in understaffed, high-pressure environments, your nervous system registers threat, period. This is called the paradox of care. The very systems set up to care for people's health are actively undermining the health of their own workforce. You're pushed into sickness presenteeism, showing up while running on empty, not because you lack professionalism, but because you can't bear the thought of what might happen to patients if you don't. That's not weakness. That's moral injury. The worst possible thing you can do in these conditions is to try to force yourself to be calm. Trying to force calm when the threat is actively present is a profound misunderstanding of human biology. Instead of calming down, you need to get internally organized. You need a biological map, one that validates your experience. But here is where it gets practical. To stay present without abandoning yourself, we use a map of relational awareness. The very first movement on the map asks one question. What state am I inhabiting right now? Am I activated, withdrawn, somewhere in between? When you notice that you're numb or hyperfunctioning, that's not a self-critique. That's vital diagnostic data. Unrecognized states drive interactions. Recognized states restore choice. The problem is not you. The problem is what you're being asked to carry alone. Now, most people stop there and treat this as a solo exercise. But that's not even the most important part. Because burnout is a relational issue. You don't regulate in isolation. We regulate each other. Before clinical meaning is exchanged, nervous systems meet. If the system is fragmented, your body will try to bridge that gap alone. One dysregulated person can unsettle a whole team, but one grounded person can help stabilize it. Bridging allows you to stay connected without being overtaken by the chaos of the room of the situation. That's why your internal state matters so much. When you're grounded, your expression can be responsive. You have choice. When you're in survival mode, your expression becomes reactive. And that reactivity spreads through tone, through pace, through the tension others feel in your presence before a single word is spoken. If burnout is relational, then it's not something you are meant to carry alone. Change does not depend on you fixing yourself. You are not failing the work.